if you suspect you have chronic infections, you're not sure, and you want to dive into that, a reasonable place to start looking into this is once you've initiated the third step of working around the sinuses. I'm going to approach this from a perspective of you don't have access to resources or your tests around tick-borne infections are inconclusive. You can't get a very clear picture of what could be happening. So, and this is something that is endorsed in different ways by different CIRS practitioners who work on this. And I'm going to be invoking some basic concepts deriving from some of these practitioners that I think are extremely useful. And so I'm trying to put together some of those insights that I think are very valuable in this context. But let's say you're here, right? You're having a suspicion there's stuff going on that's not resolved, or you already have more clear red flags that there are issues around chronic infection, something that needs to be treated in the body, not just environmentally. I would say what I'm calling a herbal provocation is a good entry point. Let's just call it a provocation sequence. And it could be anywhere from, I don't know, 2 to 8 weeks. I'm giving you like a range. This is not definitive. Depending on the information you gather from here, that might inform your next steps, whether you're going to go straight into a much more, let's say, full-blown intervention around tick-borne treatment that may include things like antibiotics or an antiparasitic drug that will be catered for that, or whether you need to perhaps do some gut intervention. And the pivoting here would be mainly dependent on how well you tolerate the provocation sequence. If this is something that is becoming really difficult to tolerate, this is something that would make sense to pursue because it often indicates, or it's a good place to build resilience in the body, to work on the, let's just call it the mucosal tissues. Marcon's treatment is meant to take care of the mucosal tissues and the sinuses. So you hopefully have enough control in that department. And then if there's a gut component, working on the gut, those two things together, in my experience, when they start being, I don't want to say completely fixed because it's going to be a work in progress. Working on the gut in this particular time often can help patients develop more tolerance to, let's say, herbals and treatments like tick-borne treatments with drugs, and perhaps eventually parasites. Often these parasites that I'm referring to here, I'm kind of separating them because there are gut treatment modalities that don't necessarily imply going after parasites fully. And so that's what I'm trying to refer to here. But that's the sequence. It's herbal provocation to inform your next move. Where are you going? And eventually, if parasites are sitting in the background, that might be like a final destination. Now, what can happen here, I'm adding these arrows now because you may spend some time jumping, doing cycles of tick-borne treatment, gut intervention, tick-borne treatment. You may be rotating those and eventually go back at parasites and then do a full cycle of these. And eventually, for people who have a lot of burden, what this is going to look like is something like this: iterations or cycles where you primarily focus on the tick-borne stuff for maybe a couple of weeks, maybe 4 weeks, maybe 6 weeks. Maybe you do then a more gut intervention again. You rotate and then you move to parasites. And maybe you look at what's going on in the nose. Do I have a recolonization? Am I having a little bit of a relapse in this process? Or do you need to do just basic maintenance in the nose? So you basically rotating, and what you're doing is you're slowly lowering signals in each of these departments.